Dear ladies and gentlemen, I'm very happy to present you a talk about the intramuscular electrostimulation parameters for a bionic smile. As a financial disclosure, I have to thank Med-El company for giving us electrostimulation devices, research grants and travel grants. Without Med-El it wouldn't be possible to do this research presented in the following slides. Also, I have to disclosure that the electrostimulation, as far as I understand at the moment, is no solution for most of our acute patients because they have a good chance of recovery. Also not for the synkinetic ones, but perhaps it could be an interesting solution for the denervated muscles. So it's only for less than 10% of our patients a solution, and studies still have to show if there's really a benefit as big as I hope it could be. For the synkinetic cases, as you all know, standard of treatment is botulinum toxin injections in the muscles or retraining, for example, with a biofeedback training. Also for denervated muscles, electrostimulation is not the first choice, but renovation operations, for example, like here shown the hypoglossal facial jump nerve suture, where you bring nerve activity back into the muscles to bring control back into the face. So to stop atrophy, to bring tone back, but also bring movements into the face. So, but when is electrostimulation used? For this case, we have to think about our problems, choosing the optimal therapy, detecting renervation, but also thinking about maximal denervation time before irreversible atrophy occurs. And at the moment, most of us work with the rule of the thumb and say that after 1 year you still have a good result, after 2 years it can become complicated because the muscle is so strong atrophied. So putting needles in can help you to give some prognosis, but also ultrasound or MRI pictures can show you the muscles and help you decide if there's muscle left for renovation operations. But perhaps electrostimulation is a new diagnostic tool to help us answer this question. When thinking about muscle atrophy, I got in contact with a colleague from Vienna. This colleague from Vienna is Professor Winfried Meyer, who had worked in the RISE study in electrostimulation of the lower limb. And he was very successful in stimulating these muscles to bring back muscle tone and structure and even a little bit function. So here you see an electron microscopy scan of a normal muscle. 15 months later, all the ultrastructure of the muscle has been lost, but after 2 years of electrostimulation, the structure got nearly normal. Also on this slide, you see that here the limb muscles get bigger by electrostimulation, the volumes get bigger, and then after stopping electrostimulation, it dropped down again. So to find more details, you can check the literature down here about the RISE project. Very interesting studies, very helpful. But there was still the concern in the room that electrostimulation would prevent renervation, so that electrostimulation would stop axons grow into the muscles. That would be a no-go. And at the same time, other people told me it would promote synkinesia. Sometimes even the same people were telling me it would stop renervation and at the same time make the renervation stronger and more misdirected. So I was checking the literature, I was checking animal experiments and found nothing what was really telling me that we shouldn't try it. So we were brave enough to go a step forward. When doing big electrostimulation operations, we were filling the gap between the first renervation occurs with surface electrostimulation to stop the slow decrease of atrophy till the time of renervation would occur. Here you see how we have stimulated the face. Two big electrodes, long pulses, 100 milliseconds, so this is tenths of a second. So it's not microseconds, it's really milliseconds, so it's really long, and these long impulses are necessary to stimulate the muscles and not the nerves. Normally, when you stimulate nearly always the nerve, and the nerve is stimulating the muscle, but not in this case because the nerve is completely destroyed. So we were trying to stimulate, bring enough energy in there that the muscle was contracting. And you see the muscle is contracting, it goes up the corner of the mouth, and then it goes a little bit down because also the depressors are stimulated. And it is well tolerable, so the patient had little pain. When looking back, we were checking all our patients and were comparing them with a historical collective before, and luckily we didn't see a delayed renervation. Here in this curve you see in blue the renervation curve after hypoglossal facial rhinostomosis without electrostimulation, and in red with electrostimulation they were even faster. But I would be careful because it was not a controlled study, but at least no hint for a delayed renervation. And also no increased synkinesia. The results are published and you can read them here in this publication from Wiebke Puls in our team. So this was a reason to go a step further. Say we can't only look for a retrospective study, but we should look for prospective studies, and we were starting together with Med-El a study where now 15 patients are included doing surface electrostimulation, and we're looking in a very distinct time pattern when renervation occurs, how the muscles are changing. The results are not yet published. But here I can give you a small sneak preview. These women got electrostimulation between these two pictures. So in the morning, then when these pictures were taken, then she did electrostimulation. And here you see still the red areas where the blood flow was increased by the electrostimulation. In the second picture is only a few minutes later. And due to the tone increase of the zygomaticus muscle, the eye closes better because there's less weight pulling down the lower eyelid, and the corner of the mouth was getting up a little bit. And here all raters, 3 blinded raters were rating it, were seeing this increase. It's not only in my eyes, but also the raters were same opinion. So there seems to be a benefit. More will be presented in the next years. The study is still ongoing, but surface electrostimulation seems to be useful. So the aim of the study I want to talk today mainly is the idea if an implant would be also possible, if it's possible to go under the skin and directly stimulate the muscle, and this shouldn't be too painful for the patient, and it should be possible to target specific muscles. And these parameters should be in an area where we can reach them with devices on the market right now, or in the pipeline to be on the market in the next years. So in the beginning we were thinking about doing it during open operations, when we were opening up the muscles, that we could then go with a stimulation device in there. But then we were realizing that putting needles through the skin would perhaps have the same benefit and would be less hassle for us, and even more interesting results. So we got the ethical approval already in 2018. Until now 13 patients are included. One of them was not performed the study because his medical condition was worsening overnight. So, but 12 patients are included. 3 of them were done during the operation in open surgery, 7 of them in awake condition, and 2 had both conditions because we had the chance to repeat it after the surgery, also with the needles. Here you see how we have put the needles in, here and here, under ultrasound control. And when the needles were placed at the right position, we were stimulating with 0.5 millisecond long impulses, then 1 millisecond, 1.5, 2, 3, 4 and 5 milliseconds. And with every impulse length, we were checking how high we had to go up till we see a good contraction. Here you see it. 2 needles are in the zygomedicus muscle, and then we stimulate and we see this nice contraction of the corner of the mouth. This is actually not 1 Hertz, so it's not a single twitch, but this is a titanic stimulation with 30 Hertz for perhaps a half a second. And there you see this nice smile. So it's not only a increase of tone, it's really a movement. And it's very well tolerated. So the patient has no problem with pain at that moment. Here you see the stimulation parameters. As mentioned, every patient was checked with the different pulse rates, and then the threshold for the movement was recorded. And the great thing is that if you compare this with the range of an electrostimulation device built for the larynx, this would fit to the into this range. So the electrostimulation device would have problems with very long impulses. More than 4 milliseconds would be complicated. 5 milliseconds is with such a device not possible. Also very high amplitudes would be a problem, but everything here in this gray area would be feasible, and all patients we have tested were in this gray area. The only ones who are just at the edge are the ones. This is one patient with a very short term denervated, but after 3 to 4 months or more than 4 months long denervation, these patients were all in this range. What is good to see that there's a good chance to go on in that direction. So the conclusion is that stimulation of the zygomedicus muscle by needle is feasible. So the patient population we have checked would be benefit from an implant. The stimulation parameter we tested are in a range that would be comparable with an implant, what is already in clinical studies for the larynx. The very complicated intraoperative assessment during open surgery is perhaps not necessary because we could switch from the open to a needle stimulation, what is much more comfortable for the patient and gives us a possibility to check it before doing any open surgery. And the results are so promising that a patient with a paralysis of the zygomedicus muscle should at least get an increased tone for a better symmetry of the face, but perhaps even if we trigger it from the healthy side, could get a triggered smile. So when smiling on the healthy side, the device could perhaps contract at the same moment to evoke a bionic smile. And no adverse events were noticed in our study. So as a summary, we have managed to transfer the results from the lower limbs from the RISE project to the face by a surface stimulation, and there are studies still ongoing, but also the next step to go closer to an implant was very successful. So hopefully in a few years on the next symposia I hopefully can present you the first implants helping our patients to look more symmetric, perhaps even smile. Thanks for your attention. I'm open for the discussion.